problem with how we approach death in the 21st century? For example, are we over-medicalising?
That's a very interesting question. So if you think about how people died 100 or so years ago in Victorian England, for example, medicine was in its infancy. We were not good at treating illnesses and diseases, and for many, many people, you got some kind of affliction, a disease, and you died from it, and doctors couldn't do anything to prevent that. So many people died in their own homes, not in hospitals, and actually with very little in the way of medical intervention. Whereas today, we are so skillful at prolonging life, or at least trying to prolong life, that in a sense we've created a very modern problem, which is the very difficult question of how do we decide how much treatment is appropriate, or conversely, when is enough enough? And that's a really difficult question that I think we're really only now in the medical profession grappling with properly. It's so easy to keep on with new treatments, new surgeries, constantly intervening to try and help someone live for longer. But of course the danger is if you do that, you are dragging out an experience for a patient that actually contains perhaps pain and suffering, and maybe the attempted treatments are worse than the disease fulfilling its natural course. So these are really difficult questions, and it's the job, I believe, of doctors to have those discussions very, very openly with patients and their families, so that patients are fully informed and can really be supported in making their own decisions about when to keep striving for cure, when to say, I can't be cured, I'm going to focus on living what remains of my life as fully as I can.